Hello, and thanks for joining us today for a live town hall discussion. My name is Joe Macbeth, and I am the Chief Executive Officer at the National Alliance for Direct Support Professionals. And today is the third installment of two other webinars that we've held specifically on the coronavirus and the direct support professional. Um, Today is a live open forum with Dr. Reiter and the staff at the National Alliance for Direct Support Professionals. The information that we're sharing today is specific to the direct support workforce, and we will provide a brief update with the doctor since the last time we spoke last Friday. And we're going to try to do our best to get to as many of your questions as possible. As you registered for today's webinar, you were given the opportunity to submit your questions in writing, and we have done a decent job of collecting them all and grouping them together because there were so many duplicates, but we guarantee you that we will get to as many as possible. I would also like to add that if we do not get to your questions and are unable to answer them specifically, we are going to provide answers to them in writing, and we will put them in the appropriate toolkits on our website. So we are committed to getting you as much information as possible today. One more thing, we will be recording today's webinar and archiving it with the rest of the resources that we've provided the developmental disability community since this crisis began. So a few other things before I turn it over to our moderator. We have provided toolkits. These are all on the NADSP website. We created a toolkit for providers, provider organizations, employers, to give them resources on how to onboard a direct support professional, to get them prepared to work with people with disabilities during this crisis. When I looked at the unemployment numbers today, upwards to about 14% unemployment in this country today because of this coronavirus crisis. A lot of people are looking for work. And what we know about our business, when people are out of work, we have jobs for them. And we also know that there's a rush to get people hired quickly and into residential settings to support people quickly. And that's good and that's necessary, but it's also something that we need to be very careful about. We want to make sure that the people who are hired to do this work are prepared and have an understanding of the job that they're about to begin for their own safety, but also the safety of the people that you'll be supporting. So we know that there's going to be a lot of new people being hired over the next few months. Our job is to make sure that we provide the disability community, the provider community, with access to learning modules on our code of ethics, on our competency areas, and a whole lot more. So if you haven't seen that toolkit, it is on nadsp.org, and it's very easy to find. And we're also adding to it all the time. The second toolkit is one resources for direct support professionals. And we understand and we know through our Facebook page and through a variety of other methods that the workforce is being tested. Our direct support workforce is being challenged, and it's stressful times for everybody. A lot of unique challenges are popping up, challenges that we never even really considered, being isolated and distancing people from the community when our job for the last 40 years was helping people with disabilities be part of the community. We're doing the complete opposite now, and that is showing a whole lot of challenges for the direct support workforce. And in this toolkit, you'll find a lot of ways that DSPs can take care of themselves. And we know that there's a lot of stress going on. So take a few moments and take a look at the resources and webinars and self-help tools for DSPs during the time of this crisis. The third thing, and this is really important to us, we need your stories, and we would like these stories in real time. We've partnered with the Institute on Community Integration at the University of Minnesota and our friends at ANCOR, the American Network of Community Options and Resources. And we've created this website where a direct support professional can shoot a very short video, 2 or 3 minutes long, and sharing with us some of the challenges, the unique challenges that you're feeling on the job. We also want you to share the good things that are happening. How are people coming together? How are your colleagues supporting one another? How is your organization supporting you? We want real stories, and not just for the sake of having a story being told. We want to collect these stories and use them to make policy change after this crisis passes, and this crisis will pass. We want to use these stories to make sure that direct support professionals are recognized as essential, not only during a crisis, but essential 365 days a year. And we want to make, we share these stories and compile these stories when we advocate for career ladders, when we advocate for living wages, and advocate for a standardized occupational code that recognizes direct support professionals. We can't make this up on our own. We need your stories. So this is a special appeal to everybody to take some time and share your stories with us. If you're uncomfortable getting in front of a camera, we understand. Sometimes this isn't the best way to do it. Send us an email at communications@nadsp.org, and we will work with you on sharing your story in writing, or maybe we can interview you. We are really committed to finding ways to capture your stories during these times, because these are unprecedented times. Direct support professionals are performing roles that they've never had to even consider in the past. Unique times. And this is one way that we can start to collect a library of really great information, and we will use it in the future. So with that, I want to once again welcome our friend and colleague, Dr. Rick Reiter. Dr. Reiter is the Vice President of Advocacy and Public Policy for the American Academy of Developmental Medicine and Dentistry. And Dr. Reiter is also the medical advisor to the NADSP. He has been kind enough to do 2 prior webinars for the NADSP. And I'm going to ask the doctor if there's any brief updates that you might want to share with us, doctor, before we get into the questions and answers. And once again, thank you for your time.
Sure, Joe. Thanks for inviting me. 2 months ago, the news that there was a nasty virus in China made it to page 8 of most American newspapers. Today, coronavirus is reported 24 hours a day on every news channel. And when it became a national concern, there was an avalanche of webinars, town halls, guidelines, alerts, and resources. Of course, as in most national conversations, people with intellectual and developmental disabilities and the people who support them were left out. Once again, the NADSP recognized their responsibility to educate, inform, and include DSPs in their need to prepare for the inherent and unknown challenges this viral assault would present. This town hall is the 3rd episode of that commitment. As we have said from the start, what you hear today may be discredited, discarded, or discounted in the weeks, days, or even hours from now. This is a moving target, and the best we hope to provide is reliable, scientifically sound, and fact-based information as it develops and as it's announced. This town hall is not intended to replace the previous webinars, but to serve as a companion to the first 2. So we encourage you to review those archived webinars, since they contain an abundance of recommendations that are still valid, useful, and purposeful. As we have shared with you from the first NADSP webinar on COVID-19, things are changed with the speed of light, and facts are a moving target. Here are some of the latest features since that last webinar. Currently, there are over 1 million cases of COVID-19 worldwide. It took 130 days to reach the first 500,000 caseload, but only 7 days to reach the next 500,000 cases. In the US, there are about 1,000 deaths from the virus every day. We are seeing about 250,000 cases in the US with almost 6,000 deaths. New York remains a hotbed with almost 93,000 cases and 2,300 deaths. That is far more cases than in the countries of Germany, France, the United Kingdom, and China. The apex in New York is believed to be between 7 and 30 days, but probably closer to 7 days. 45% of Americans have reported the virus has impacted on their mental health. That certainly relates to DSPs and the individuals they support. The CDC is expected to announce that all Americans should wear cloth masks or other face coverings if they go out in public. This is based on new concerns that the coronavirus is being spread by infected people who have no symptoms. The Labor Department reported that in the last 2 weeks, over 10 million jobs have been lost, which should also have an impact on DSPs as they get a new wave of wannabes. At least 38 states have announced plans for stay-at-home orders that will last for weeks. Law enforcement officials will be able to impose fines if you violate these orders, fines of up to $5,000 and up to a year in prison. City officials are considering shutting off water and power to non-essential businesses that remain open after being warned. The FDA, the Food and Drug Administration, approved the first test for coronavirus antibodies for use in the United States. This test tells doctors whether a patient has ever been exposed to the virus and having recovered and now may have at least some immunity. This is important for several reasons. People with immunity might be able to venture safely from their homes and help shore up the workforce. It may be particularly important for doctors and nurses to know whether they have any antibodies. But just having antibodies does not guarantee immunity from the coronavirus. New evidence suggests that people are most contagious 2 or 3 days before the onset of any symptoms. Despite our longed-for hopes that people with intellectual and developmental disabilities will be included in all aspects of society, we have seen evidence to the contrary. State health departments across the country have provided guidelines on excluding people with cognitive impairments if there was a shortage of life-sustaining medical devices, most significantly ventilators. I'm glad to report that the disability community responded immediately and lawsuits were initiated. Groups advocated for cognition for not being a criteria for exclusion or denial to access to medical care. While it appears that we have successfully advocated, it's proof positive that our ongoing need to be constantly vigilant and hypersensitive to these indignities. Despite it being a violation of the Americans with Disabilities Act, when society is stressed, they are quick to discard both the law and common human decency. We will keep the NADSP abreast of any additional threats. Most recently, experts have said that the virus spreads only through large droplets from a cough or sneeze. The most current belief is that the coronavirus may be spread through the air in tiny particles that infected people exhaling during normal breathing and speech. Current available research supports the possibility that this virus could be spread via what we call bioaerosols generated directly by patients' exhalation. If the coronavirus is airborne, that could help explain why it is so contagious and can spread before people have the symptoms. Additional finds could indicate that physical distances by at least 6 feet may not be enough to limit spread of the virus. Whether infectious viruses could be carried that far, or if it's simply the genetic material from dead viruses, isn't yet known. That basically wraps up current updates that I think are a concern to DSPs.
Thanks, Doc. So my role now is to introduce Nicole Dominic. Nicole Dominic is the NADSP's Office and Communications Manager and responsible for pulling all of our resources together and making sure that everything gets out to the field. So Nicole is going to be the person who's going to be moderating these questions as they come in, asking the questions to the rest of the staff. So Nicole, welcome and thanks so much.
All right. Hi. Good afternoon and good morning to folks. As we move forward today, I'm going to introduce the people on the panel who are going to be answering the question today. So you've already heard from Joe Macbeth, our president and CEO. You'll be hearing from also John Raphael, who is our director of educational services, Dan Hermrich, who is our director of certification and accreditation, Desiree Laxbear, who is our COO, and Dr. Rick Reiter, who you've also heard from this morning. So with the questions, I am going to say that when folks registered for the webinar, people were able to submit questions, and we had hundreds of questions come in. So how we're going to start this is that I'm going to read some questions that we've taken from registration and move forward in that manner. I do see questions coming in through chat and through the question box, so please submit your questions that way. And as we've stated, if we don't get to your question today, we will be answering them, grouping them all and answering them and putting them on our resource pages. So without further ado, I'm going to start with the first question, which is a medical question, and it goes to Dr. Rick Reiter. And it is COVID-19 just a really bad flu? What is coronavirus? Is it the same as COVID-19?
Let me first say a word about our answers to these questions. You may not like them and you may not agree with them, but be confident that they represent and reflect the most current advice and recommendations. Like so many things DSPs have to do, you may have to adopt them, modify them, choke them, and try them out. This is an ongoing conversation. So if you have come up with any successful actions or solutions to some of these situations, please share them with us and we will make them part of our future offerings. For better or worse, we are, at least for the time being, all lab rats. So help us find the cheese. So that's a three-part question. So let's take them in order. Is COVID-19 just really a bad flu? One can simply dismiss this question by simply saying yes. But in reality, what I am assuming you mean by just a really bad flu is a reference to what we have called seasonal flu, the kind of flu we get vaccinated against every year. That flu in itself could be considered really bad. Looking at last year's seasonal flu records, we saw approximately 54 million flu illnesses. We saw 26 million medical visits for flu and logged about 700,000 hospitalizations, resulting in 60,000 deaths. So I would say the seasonal flu carries a huge burden. So the seasonal flu, at least statistically, has been more of an impact than the coronavirus. The difference is the worldwide spread, the velocity of the spread, and the reaction from public health officials. More specific to the question, the current corona flu is indeed bad unto itself, and the response from the medical field pays respect to that virus. The coronaviruses are a group of related viruses that cause diseases in mammals and birds. In humans, coronaviruses cause respiratory tract infections that can be mild, such as some cases of the common cold, and others, SARS, MERS, and COVID-19, stands for severely acute respiratory syndrome. Human coronaviruses were discovered in the 1960s. The earliest ones studied were from human patients with the common cold, which was later named human coronavirus. Is it the same as COVID-19? COVID-19 is the disease that is caused by the current novel coronavirus. We call it novel because it has never been seen before. The change is part of the nature of all viruses in that they are constantly trying to mutate to better overcome our immune system. But the terms are being used interchangeably. The CO stands for corona, the VI stands for virus, and the D stands for disease. The 19 is for the year of the outbreak and the year it was identified, being in December 2019.
Thank you, Dr. Reiter. So moving on to the next question, it is, am I an essential employee? It is confusing and I am getting mixed messages.
This is Joe Macbeth. I think I'm going to start with this one. Am I an essential employee? Well, of course you're an essential employee, but the determination of an essential employee during the coronavirus is determined by the state's governor. And if you're not sure if you have been identified and deemed as essential, ask your employer to look into that for you. But this is kind of confusing because when you take a look, I looked at Massachusetts last week, and Massachusetts direct support professionals are deemed essential by law. And it's tricky because they identify personal care attendants and home health aides as essential, but direct support professionals have been explicitly left out of that category. And why is that? Well, first of all, because direct support professionals has not been identified with a standardized occupational classification as set forth by the United States Department of Labor's Bureau of Labor Statistics. This is a great example of why we need to secure that standard occupational code, because you are anonymous, you are unknown to a great many people, and you do everything a home health aide does, or a personal care attendant does, or a certified nursing assistant does, but they're seen as working in a medical model. And direct support professionals provide medical supports to people who are highly vulnerable to COVID-19, but they've typically worked in a community model. And yes, you are essential not only during this crisis, you are essential 24 hours a day, 365 days a year to this population who is vulnerable to some serious effects of COVID-19. But to answer that question specifically, you have to check with your state. It's easy to find, and you should very easily be deemed essential. John, Dan, Desiree, anything to add to that?
No, I think this is John. I think you nailed it, Joe. And I think the confusion comes from the legality and what that word essential means. Any direct support professional knows whether they work up in the northern hemisphere when there's a snowstorm, oh, they're essential. When a hurricane blows through the panhandle of Florida, they're essential. But I think what you hit on is so important, and that's why we want those stories, right, Joe? We want those stories because if you go to many people in the general public, they don't know what a direct support professional is. They know what a home health aide is. They know what a personal care aide is. They don't know that direct support professionals are as vital and as much professional as any other quote unquote essential employees. So I think you nailed it.
And one last thing, because now on our website, we have a whole page dedicated to rallying and advocating for that standardized occupational code. So you can learn a lot more just on our website. Go to the home page. It's scrolling across the banner. DSPs should not be anonymous anymore. So thank you, Nicole. You can move on.
Okay, our next question is a medical question for Dr. Reiter. Can I get COVID-19 easily as a DSP, and what should I do to protect myself?
Well, the answer obviously is yes. As a DSP, you can get COVID-19, but the answer to your question of getting it, quote, easily is not so cut and dry. As anyone working in the field of human services, it implies that you work with people, and typically several, if not lots of people. With every human encounter, you are increasing your chances of being exposed to the virus. It's obvious that the higher the density of people in your world, the higher the chances of you being exposed to the virus. In terms of what you can do to protect yourself, there virtually is no difference in the protocols to protect yourself if you're a DSP, a plumber, or a teacher. Following the specific guidelines from the Centers for Disease Control provide a sensible, rational set of recommendations. By now, they should be ingrained in your psyche, and of course, they include hand washing with soap for 20 seconds, frequent use of hand sanitizers, social distance of at least 6 feet where possible, ongoing use of disinfectants for frequently encountered surfaces, reminders not to touch your face, especially your eyes, nose, and mouth, use of face masks, and to ensure that you are using them correctly, removing your shoes and clothes when you return home from a shift, and a thorough showering, including body hair, and of course, maintaining social relationships by phone and Skype. Exercise and proper nutrition are always recommended to boost energy, health, stamina, and your immune system.
Thank you, Dr. Reiter. Our next question is for the NADSP staff. What should I do if my supervisor or coworkers aren't taking this seriously?
This is John, and this is a vital question, obviously. Our code of ethics is very clear that we have an obligation to the people we support. They're our first allegiance is to them and their well-being. And whether it's the COVID-19 or if it's some other calamity or other problem that you're seeing as a direct support professional that your coworkers or your supervisor aren't taking seriously, you have an obligation to take care of that in whatever means that might be. Whether it's they're maybe not doing the social distancing piece. They're doing something that you see, or they maybe even state that, oh, this is just a bad cold. When we all know at this point, you know, and you know as the direct support professional at this point, no, this is serious business, and this is something that's highly contagious, and so forth. You have an obligation as that direct support professional to do your chain of command. Corporate compliance. Oftentimes, an organization has a corporate compliance office or a corporate compliance officer, where if your coworkers aren't following policies and procedures and rules, you have a recourse for that. It's not easy to do, takes some courage to do it, but you have the obligation not only to the people you support, but to yourself, especially given such a very contagious disease. Dan, Joe, Desiree, any other comments?
Yeah, this is Dan. I would just add to that, John, that in some states DSPs are mandated reporters of things like abuse and neglect.
Mm-hmm.
And that obligation certainly wouldn't go away during this COVID-19 crisis. If you feel the people you support are being put in danger by the actions of your coworkers, that's the kind of thing you may be mandated to report.
Right.
Great. Thank you. So the next question is for Dr. Reiter. What if I suspect a person I support has COVID-19? If they are displaying symptoms, what should I do?
The answer to your question, what should I do if I suspect the person I support has COVID-19, would be the same regardless of who the person is. So your action would be the same if you suspected a family member, friend, or even yourself. Your suspicion should start with observing signs and symptoms. By now, the classical symptoms should roll off your tongue. Signs and symptoms may appear 2 to 14 days after exposure, and typically and classically include fever, cough, shortness of breath, or difficulty breathing. But don't discount tiredness, aches, running nose, and sore throats. Some people in the later stages, but now we're starting to see them earlier, have experienced the loss of smell or taste. Most recently, we have also been aware of GI symptoms, including diarrhea. The first thing you should do is isolate them to the extent possible. In a group home, that might simply mean ensuring that they stay in their own room and avoid common areas in the house. Depending on the policies and procedures of your agency, you should institute whatever action is indicated in seeking medical care. That could be a call to the person's primary care physician, going to the emergency room, which if you can avoid that, avoid that. You should also communicate with the individual's family or conservator, or perhaps a case manager. This is where the role of the DSP as a health advocate comes into play. If you escort the person to an office or clinic, be sure to have all up-to-date medical information, a medical passport to share with the provider. And as always, provide comfort and reassurance to the individual. As you well know, going to clinics can be very stressful for individuals with low understanding and low coping skills. Also, to the extent possible, encourage your folks to participate in their own self-care. That includes taking meds, personal hygiene, sharing their feelings, and making healthy choices.
Nicole, this is Joe. I just want to add to that because the doctor talked. One of the first things that the doctor talked about was assessment, and if you take a look at the NADSP competency areas, and these competency areas are the foundation of direct support work. They are nationally valid. They are universal. And area number 3 is called assessment. The direct support professional should be knowledgeable about formal and informal assessment practices in order to respond to the needs, desires, and interests of people with disabilities. That's the first thing. And then when you take a look at these 15 different competency areas, you go down and looking at supporting health and wellness, promoting health and wellness for all of people that you support, including administering medications and using appropriate first aid and safety procedures and universal precautions. These are things that DSP should be doing and in fact are doing every day already. And I don't think DSPs, and John Raphael says this really well, DSPs don't give themselves enough credit for their skills. You have these skills. They're written out for you. You validated them yourself with your work. And I really want people to understand that even in this crisis, DSPs are doing these skills intuitively. And I think we need to raise the awareness of these skills and start doing them more intentionally.
Mm-hmm.
Thank you, Joe. The next question I have is, First off, it says, I feel obligated to work even though I'm feeling sick and unwell. What do I do?
I think the doctor's going to answer that one too.
Yes.
Yeah, Doc, you want to go first? Because I got, this is a softball for me, unfortunately. This is John. But Doc, do you want to say anything about that?
No, I'll defer to you.
Okay. Look, direct support professionals are notorious, right, for going into work when they're tired, even when they're sick. We get that because direct support professionals need to work. They are dedicated to the people they support, sometimes, you know, almost blindly in that they're sick and they might be bringing something to work that they probably shouldn't be bringing, whether it's just a common cold or whatever. I think we have an obligation backed by our ethics, right? And Joe spoke about our competencies of supporting health and wellness. We have an ethical obligation to promote physical and emotional and personal well-being with the people we support. And we have to take, I think, a look at why direct support professionals feel obligated to go in when they're sick. They're not the only professionals that will do this, but I'll tell you right now, there's many other professionals that will rely on their sick time. They will take heed and have a sick day and not burn a good sick day on not being sick. And that's I think an issue with this workforce, in my opinion. They're pushed, direct support professionals are pushed often to work when they probably shouldn't, whether that's a financial reason or a commitment to the people they support, a lack of staff, and person power in a program. I really believe DSPs need to, especially with the COVID-19 issues, it's because this is so dangerous. If you're sick, you can't be bringing this to the people you support or to your coworkers. Dan, Joe, Desiree, Doc.
No, I think you nailed it, John.
Yeah, this
Yep.
is Desiree, and I agree. I mean, remember, this is so very, very contagious. You don't want that coworker of yours coming into work not feeling well and possibly putting you and the people you support and possibly even your families at risk. Be considerate. You know, if you wouldn't want the guy next to you doing it, don't do it.
Yep.
Thank you, everyone. As a follow-up to that question, this one's for Doc Reiter, but anyone can take it. What if I detect my coworker has symptoms of COVID-19? What should I do if one of my coworkers or my supervisor has symptoms and tells me that they're sick?
Yeah, again, the mission of health must prevail in this situation. They, of course, need to follow your agency's guidelines, which I assume and hope indicates that they need to see a provider before they can return to work. Now, I know sometimes it gets a little hairy when you have to tell your supervisor that they need to leave the premises. It requires a real commitment to the individuals you support by overruling your superior and insisting that they get out of Dodge. But it needs to be done, and hopefully your supervisor will understand, appreciate, and support your standing up at this time. If it hits the fan and you're terminated for insubordination, come see me in Chattanooga. We will readily hire you. We love insubordination when it was necessary to protect our individuals.
Thank you. Thank you, Dr. Reiter. The next question submitted was, I'm feeling overwhelmed and I'm feeling underappreciated and disrespected at my job. What do I do? Any suggestions?
Well, this is Joe. Let me start. I know we all probably want to say something about this. I'm feeling overwhelmed and I'm feeling underappreciated, and you're not alone. And of course you are. This is an overwhelming time for everybody, and I think especially for direct support professionals because there's so much unknown, and we're asking you to do so much more. I do know many of my friends run organizations and work for organizations in management and administration, and they are trying really, really hard to find creative ways to appreciate you. Sometimes it may feel like they're not doing enough, but I can assure you that everybody's thoughts and efforts are going to make sure that direct support professionals have the tools and the resources and the equipment that you need to do your job. We often say that quality is defined at the point of interaction. That's never been more true than today. Quality happens at the direct support practice. And I know, just speaking with my friends who run organizations and people who are on the board of directors of NADSP are really trying to turn over mountains to make sure that you understand that you're respected and appreciated. And I can go on the record, when this passes, and it will pass, we are going to take these stories, and this is why we want your stories. We're going to take these stories and use them to affect public policy, to use them to make change and create this profession that we've been talking about for 20 years. So I know you're overwhelmed. I know that you feel devalued and disrespected, but the entire disability community is looking to the direct support workforce to rise to this occasion. And like every other time, you will rise to this occasion. After it passes, it's up to us to work together to create a coalition to make sure that you are respected to the level that you deserve. John, Dan, Desiree?
Yeah, I've got to follow that up. Thank you, Joe. Look, yes, you are, as direct support professionals, we know, we just talked about it, you're essential, you're vital, you're skilled, you're competent, and you are exhausted. And I think you're just like a nurse, a registered nurse, a physician that's fighting this war. That's literally what's going on, right? They're also exhausted. The difference is there's a different recognition level that goes with the doctors, with the nurses, because of what we've talked about for the last 45 minutes, that you are anonymous, that the world doesn't know what you do. Of course, the people you support know what you do. Your employer knows what you do. The families of the people you support know what you do. And they are, I'm sure, appreciative when all is said and done. But I think ultimately, I've been seeing a lot of memes on Facebook and wherever, LinkedIn and all, all the social media stuff. And and you've all seen them, I bet. Oh, suddenly now it's the truck drivers, it's the grocery clerks, it's the healthcare professionals, meaning, and you're lumped in there. You're lumped in there. You're lumped in the healthcare professional, quote unquote, world. You're part of this now going to be respected workforce. And that's what our job is when this is all said and done. Like Joe said, our job is to show the world how unbelievably important you are, and you deserve much more respect. So that's what I got.
Thanks, John.
Thank you.
Can I add to that too? This is Desiree. And again, you are working on the front lines. You are working very hard. You're tired. You're scared. Just don't forget that administrator is also tired and scared and trying to come up to speed as well. And they're probably in the moment doing the very best that they can as well to support you. And maybe it doesn't feel like enough in the moment. I can't imagine being in that position, though, having spoke with an executive director a few days ago who lost a few people that he supports to the COVID-19. I know he's grieving as well and trying to figure out the best way to be able to safeguard all you in a time when there's just no good answers, and we're learning as we go. What do they say? Building the airplane while flying or something like that, right? So maybe again that administrator's not doing the very best in your opinion, but try to recognize that maybe they're doing the best that they know how, just like you are as well. And they do appreciate you. They just may not be able to say it at the moment in the way that is going to be heard loud and clear. We will continue to be able to fight your cause, though, and do the best that we can to share your stories and make sure that others recognize the relevance of your work as we move forward.
Thank you. Moving forward, the next question is for Dr. Reiter. I'm frightened for the people I support. I know that they have different types of pre-existing conditions that make them vulnerable to the virus. Any advice?
Yeah, people with intellectual and developmental disabilities are not at any greater risk for developing COVID-19. They are, however, at higher risk for having complications from the disease, especially individuals with cerebral palsy, Down syndrome, and other conditions with low immunity do not have the same recovery rates as other people. Being frightened for the people you support is a good starting point, but in fact, we don't want you to be frightened, as that often leads to indecision, inaction, and defeatism. Take a helping bunch of that fright and convert it to being alert, vigilant, and resourceful. Use the fright as something that will keep you focused, challenged, and hyper attentive. Best advice is to go back to basics. Know the symptoms, know the individual, and be proactive. Be aware of how that person's environment, their habits, routines, relationships, and behaviors may impact on their vulnerabilities. Think of protecting someone from COVID-19 as a chess game, and how and why you should be at least 2 moves ahead. Be aware that while your individuals might not fully understand anything about virology, they are intuitive and know when things are out of whack. They know when routines are being changed and that there is a sense of heightened scrutiny going on around them. Be sure to reassure them that you are there to protect them, you're there for them, and you will continue to support them and respect them.
Thank you, Dr. Reiter. The next question is, does NADSP have suggestions on how to approach my work differently in light of this pandemic? Am I a healthcare worker? It seems like with all this extra precaution and medical focus that I am.
This is Dan. Obviously, direct support professionals are essential. They play an essential role in helping the people they support to access healthcare. But that's just part of that direct support skill set. Direct support is an interdisciplinary profession. It draws on skills that come from so many other different professions. Driving is often an important DSP skill. Teaching is often an important DSP skill. DSPs can be like life coaches in some way. And so, yes, you play a vital role in healthcare. And right now, that's really coming to the forefront. But you also have this wonderfully complex and diverse skill set as a direct support professional. And don't forget about all those other skills you bring to the table. John, Joe, any further thoughts?
No,
Nope,
I think you
it.
got it, Dan.
Thanks.
Right. Thank you. So for the next question, it's for Dr. Reiter. Are hospitals equipped to care for a person on the autism spectrum if they become ill with COVID-19?
I would say universally, not typically. Therefore, the DSP has a role as a hospital sitter, and that's a bad name because the DSPs do a lot more than just sit in the hospital. The hospital needs to know that they are there, they're available, and what specific roles they play. We don't want any gray areas to confuse people in the hospital setting. And with that, I want to promote the idea that we should advocate for a differential pay for the skills that are required by a hospital sitter. It's not just watchful waiting. It's being proactive. It's being an interpreter. It's being a counselor. And certainly it's being an advocate. And it's not just for folks with autism. It's for folks with any special needs.
And this is Joe, Doctor. I just want to add to that. As part of the CARES Act that was passed last week, our friends at Anchor have really been active in supporting a piece of the CARES Act that allows for the provider community to bill Medicaid when a person is in the hospital and requires the support of a direct support professional. That is huge. That is a big change. So now organizations can be paid when a DSP is working in a hospital setting. And I think that's comforting to people with disabilities and their families to have somebody who knows them and knows what works and what doesn't work, rather than relying on a nurse who is got another job to do. And I couldn't agree more. The skills that are required of a DSP in a hospital setting is beyond what we ask of them in typical settings. And I do believe, and I would advocate, that when DSPs are working in that setting, in a unfamiliar setting with a lot of other healthcare professionals, your focus is on that person, and you are working with that person to make sure that that stay in a hospital is brief and effective, and it requires a completely different skill set. So I think our job is to promote, and we're so happy to work with AADMD on this, to make sure that DSPs are prepared to work in those settings. So thank you for that.
Okay, thank you. So the next question is, how can I help people I support be less bored? And how do I do any, in quotation marks, community inclusion? That's my job and I can't do it. I need help. Any ideas?
John, go ahead.
Oh my goodness. Real quickly, we have a Facebook page that we monitor and we see, and this direct support professionals are very creative. They're very creative and they're really good at this kind of thing. I think one thing we can do, and look what we're doing now. I mean, it's all throughout, pretty much throughout the world. We are relying on social media platforms like FaceTime and Skype and the aspects of Facebook where you're communicating with other people who aren't in the same room, and they might not even be in the same country. The point of this is, I think we have to allow and probably lighten up on maybe some of the policies that are out there. And some administrators might get mad at me, but the reality is direct support professionals need to be able to use social media much more in earnest than they have been perhaps allowed to. And what happens is social media and things like an iPhone or a smartphone or a Droid, whatever, if it has a camera on it and it can connect you to somebody else, man, there's some community integration, and there's where you can achieve social capital, as our dear friend Dr. Al Condalucci talks about a lot, meaning that you're not totally obliged to be going to the bowling alley to have social interaction. Use social media, use the things that we're all now relying on. In fact, one real quick story, we are, as the National Alliance for Direct Support Professionals, we are meeting more now as a staff than we ever met before. And that's because of the use of social media mechanisms like, Zoom. So that would be my suggestion, using social media. Dan, Joe, Desiree, anybody?
I just need to say a couple things. No, you are not doing any community inclusion during this crisis. That's not part of your job. You cannot do community inclusion out in the community. But as John said, there's other ways that you can do it. And he is absolutely right. DSPs are creative. And some of the most creative people that I've ever met in my life are really good at direct support. I also think that that the direct support workforce needs to be given the authority well, I won't even go there. I think direct support work needs to be done by people who have relationships with people. That's what scares me so much with a lot of new people coming in to do this work in settings that you're isolated from the community. You're also going to see an increase in challenging behaviors, and we're seeing that on our Facebook page. And that's happening for a variety of reasons. People's daily routines have changed. They may not understand why, and DSPs are there once again dealing with some of these challenging behaviors. And relationship building takes time, and the better the relationship, the better the DSP knows people, the less boredom, the less challenging behaviors, the healthier atmosphere that you will see. That's why one of the reasons why DSPs are so critically important and essential, because you are dealing with things that most people will never have to deal with.
Mm-hmm.
Yeah, and this is Dan. I would just add, to the greatest extent possible, I think it's important that all those creative ideas that DSPs bring to the table, that you develop those in partnership with the people you're supporting. You don't want to, come with a fully formed plan for how the day is going to go, because every day is different in direct support. Talk to the people you support, follow the lead of the people you support in terms of what would they like to do that day. It may be a great day for arts and crafts, or it may not be. maybe a great day to do that virtual museum tour, but it may not be. So plan together and you know, listen to the people you support.
Thank you. So this question's for Dr. Reiter. What types of proactive and preventative measures are provider organizations using as a response to COVID-19?
Well, probably the most important measure that we've learned is that typically most agencies did not have meaningful, reliable, real-life emergency policies in place. So that's something that not only are they scrambling to put together, but basically using that as a predictive analytical piece of data for the future. What else are we missing in our plans? Certainly strict adherence to the CDC guidelines is first and foremost, and that basically includes no visitors to group homes. Certainly, as we mentioned, postponement of community excursions, loosening of some of the regs like limited staff work ratios for clients, etc., and also the fast tracking of new hires to basically, typically it probably takes 2 to 3 weeks before somebody is even hired with background checks, and then another 40 hours of pre-service orientation. So they're basically looking at what are those pre-training courses can be done online, etc. And it also basically embraces the idea that seasoned veteran DSPs need to work side by side with the new hires. We certainly need them, but it's probably the worst time for someone to enter the field. We also want DSPs to become DSPs because that's what they wanted, not because this is what they needed at this point in time. But we also realize that sometimes being exposed to scenarios and situations and opportunities that you didn't plan on basically, seals your fate. And so it's a great opportunity to expose people to the challenges and the rewards of being a DSP.
Thank you, Dr. Reiter. The next question that we received, it says, it does not seem fair that some administrators can stay home and we can't. Shouldn't they be here with us to help, especially when we are short on staff?
Oh boy. Well, I was waiting for that question. It's not an us and them, and we are all working in this crazy environment together. And trust me, you don't want a parade of people in and out of these settings. You want people who are healthy. You want people who are familiar with the people that you're supporting. And frankly, administrators can support you from afar. And I think in terms of administration in organizations, my only advice to you is communicate, communicate, communicate. Be present, be thoughtful, provide resources when you can, leave no stone unturned, but it goes to the culture of an organization on how direct support professionals feel respected and valued and heard. And I think at this time, it's not us and them. It's not the higher ups and the DSPs, and that drives me crazy. You're all in this together. We're here to support you. And I think organizations need to rally behind good communication, building a strong organizational culture, celebrate successes, share grief, and be there when something sad happens and people pass. We need to do a whole lot of self-care here. And just because administration may be working remotely from home doesn't mean they're not working for you. You have to understand that. Everybody's working, and bills are being paid, and finance is working, and HR is trying to get new people in, and your training department is training new people remotely. And I could not agree with Dr. Reiter more. There are going to be new people coming into this field. I want them to want to do this work, not just because they have to. That resonated with me, Doc, and thank you for saying it. John, Dan, Desiree?
I think the C word, communication, when you're a direct support professional and you are feeling the pressure, feeling that real burden at that moment where whatever, maybe there's not enough personal protective equipment, maybe there's some system that you're just not happy with, communicate that to the administrator, your supervisor, and they need that. They are dependent on that. And that's all I would add to that, well, everything what Joe said, but you need to let administrators know what's going on the ground, because at this point in time, especially like Joe said, you don't want people that aren't familiar with the people you support anywhere near them for various reasons. That's what I have to add.
Thank you. The next question is, shouldn't everyone be wearing masks since they are asymptomatic carriers of COVID-19? This is for you, Dr. Reiter.
Sure, thanks. I was waiting for that one. There's probably no other recommendation than the efficacy of wearing a mask to demonstrate how fast things change. Several weeks ago, the CDC and every single infectious disease scientist basically boo-hooed the universal wearing of masks. Probably by the end of business day today, the CDC will probably announce that they are recommending that everyone should wear masks. Of course, the ultimate mask is the N95. The 95 refers to the percentage of pathogens that it protects from, but there aren't enough of them to go around. So basically, anything that covers your mouth, providing that it is clean, and basically that it covers your mouth. One of the problems is the inappropriate use of them. We're now basically saying that even a T-shirt is better than anything, if not even for its placebo effect. It's also a constant reminder wearing a mask that you shouldn't be touching your face, especially your eyes, nose, and mouth. But basically, touching your face is part of the universality of the human condition, and we probably touch our face intuitively and intrinsically hundreds and hundreds of times a day. So that's one of the things that you can drop. We are now recommending the reusing of masks just until the shortage is resolved and addressed. And that would also include spraying the outside of the mask with a disinfectant and cleaning that and washing that and letting it dry for at least 24 hours, because the last thing we want to do is basically inhale disinfectants. But I'm sure we'll be seeing more and more people wearing masks.
Okay, well, thank you, Dr. Reiter. This is Joe. I'm going to wrap this up. As always, you've become the voice of reason for direct support professionals and organizations that support them during this coronavirus crisis, and we can't thank you enough, Doctor. And I'm sure we're going to be doing more as this goes on. I want to thank everybody, and we're reaching a whole new audience with these webinars and our resources and toolkits, and please consider looking into joining our membership. We're here 24/7, 365 days a year, and there's a lot more that NADSP does for our community. I also want to just remind people that this webinar has been recorded. It will be posted on our YouTube channel. If you're not a subscriber, we ask that you do. All of our webinars that we've been doing during this time are posted on our NADSP YouTube channel. I also want to make sure that you know that the questions that we did not answer, we are going to do our very best to provide them answers in a document and post them in our toolkits. So with that, I want to end this hour of Q&A. I hope we did a service for you. I hope that we helped give some good answers and some sound information. Stay healthy and stay safe, and make sure that the people that you support also remain healthy and safe. We know the work that you're doing is incredibly challenging, and the NADSP and our partners are here for you. So thank you very much. I'd also like to thank the NADSP staff, who have been just incredible and a resource of great information. So John and Dan and Desiree and Nicole, thank you, and we'll talk soon. Take care.